Hi, everyone. Thank you so much for joining us. This is Inga Hansen, editor of Metasthetics Magazine. We're going to get started. If you have any questions during the webinar, you can type them into the question box on the right-hand side of your screen, and we'll answer them at the end of the presentation. Today, we'll be talking about post-procedure skincare protocols to help increase patient retention by improving outcomes and enhancing patient comfort and appearance immediately following aesthetic treatments. Our presenter is Ted Ebel of COLORESCIENCE. Ted has more than 20 years' experience in dermatologic and skincare product innovation, working with companies including SkinMedica, Vitamedica, and Menlo Therapeutics before joining COLORESCIENCE. Welcome, Ted.
Thank you, Inga. It's a pleasure to be here today. This is a presentation that we've given to a number of our top accounts in the past, based on some clinical trial work that we've done that we're quite excited about. We usually call this presentation Procedure Skincare Protocol to increase both patient and practice outcomes, and that will be a theme that you'll see as we talk through this presentation today. So to begin with, I'd like to take a quick look at the historical role of skincare in the treatment office. As you know, the majority of reasons why patients are coming to your office today is really to receive treatment. And the number of treatments that patients are seeing is rising every day, as we'll talk through in just a moment, in terms of aesthetic treatments. Then there's kind of a disassociation where a patient ends up at the end of their checkout. You likely have a retail setting in your practice. A patient may choose a collection of products, either of your own or from one of the brands that you happen to serve there, and then checks out. And on occasion, they may be ushered there with an esthetician or a nurse practitioner in your practice that helps them select a set of products that is best suited for them and possibly even from the procedure they just had. But really, it's a disassociated process right now where there's no direct link to the treatment that the patient has received and that skincare product that they're receiving later on. And we know that skincare is certainly important to your practice. It's important for one thing because it is an additional revenue stream. It's also important because it's an attachment to that patient on a more frequent basis sometimes than the aesthetic procedures themselves. But we know at the end of the day, it's a small, relatively small percentage of a practice's revenue. The bigger practice revenue is clearly tied up in the procedures. And when we look at this next page, these are data that many of you will be familiar with. This is ASAP's data. We know that there are now almost 12 million procedures each year. This is from 2016. Given the growth rates that we've been seeing, we know that there probably are in excess of 12 million non-surgical procedures that took place in 2017, and there's no sign of this slowing down. You can see some of the larger procedures here: hyaluronic acid, chemical peels, full field ablative, IPL, microdermabrasion, some of the ones that we've highlighted. These are particularly amenable to side effects and issues that a patient universally will have at the end of these procedures. And that today there's not really a standard way of dealing with those side effects and making sure that a patient has a particularly good outcome at the end of that procedure. That's what we embarked upon with this clinical trial protocol that we engaged in, is to improve that patient experience and ensure that they had a stronger affinity to the service that they just had at the practice as well. If you look at this next slide, you can see when we talk about growth, these non-surgical procedures at the bottom, they've been growing on average over 7% a year. So eclipsing, just about anything else that you're seeing in your practice. And several of these, including HA, are growing in the mid-teens. Even though HA fillers have been around for a while, no sign of slowing down at all. Particularly impressive are some of the energy-sourced initiatives, such as IPL, that has grown 36% in 2016 relative to 2015 to over 650,000 procedures. We know that several of these are also underreported. Microdermabrasion, we know, is substantially higher than 588,000 in 2016. And even though those don't have the level of side effects of something like IPL or laser resurfacing, patients still have redness and some level of sensitivity at the end of that, and could be well served to have a treatment at the end of their procedure that gets them on their way and feeling better. When we look at the treatment side effects that I referenced earlier, you can go right to the labels. So if you look at the package insert for Juvederm, the majority of patients have a variety of these treatment effects. And this is obviously one of the lighter treatments that patients are receiving. So when we look at IPL, laser resurfacing, microneedling, these adverse events or complications that are just a part of the procedure go up even beyond these levels. So a few that we've highlighted here: redness, bruising, swelling, those, and firmness, those all are in the 80 percentile range. You may or may not be familiar with this, but over 80% of your patients are expressing some concern associated with the redness, bruising, and swelling from that procedure. And what's even more interesting, if you look in the middle column, about 30% of these patients, 20 to 30% of them, are experiencing moderate to severe adverse events or concerns related to these conditions of redness, bruising, swelling. And many of them are also experiencing things such as itching, you can see 33%, discoloration, and tenderness and pain. So it's something that we're seeing throughout the aesthetic community. And again, these are elevated with more advanced, more significant procedures, even beyond HA fillers. So what role does a skincare regimen play in helping to satisfy the patient need and overcome some of the natural concerns and adverse events that take place with these procedures? Well, we've looked very thoughtfully at this, and there are really three key elements that we feel are critical in a skincare routine after surgery. The first is sun protection. And from our perspective, it's not just any sun protection. We know that the majority of you feel the same way we do, and that is that these should be chemical-free actives. All physical protection. It's the way that we formulate all of our products, only with zinc oxide and titanium dioxide. We don't use any chemicals that may be irritating, especially after a procedure such as this. And of course, we're always focusing on broad spectrum and very high levels of SPF, as well as UVA protection. We also are increasingly talking about the need to have general environmental protection. So patients may have these procedures in the middle of the winter time and in areas where they may be more exposed to pollutants and adverse conditions, not just UVA and UVB concerns. The second area that's critical is the skincare element. And there are a few attributes here that we take great care when we're formulating our products. And we hope that any products that you use, even if it's not ColoreScience, you're thinking about these same things when using them after post-procedure. So one is, do these skincare products have a calming, soothing effect? So we formulate with very high levels of zinc oxide, which is a known calming agent, as well as other agents. The second is, are these breathable? Are they going to get absorbed? Is there a problem with using these after treatments, which is something that we're very careful? Are these products that may give you adverse events because of the kind of dyes and talcs that can be used, which we don't use either? And then third, does a skincare regimen include ingredients that support your treatment objectives? And this is something we'll talk about more when we look at our treatment products, but we formulated our treatment products to complement the objectives that you have in the aesthetic services that you're providing. In particular, looking at browns, reds, inflammatory concerns, concerns around the eye versus total face. So we've really taken that to heart when we've launched this skincare regimen. And then finally, these patients, while not necessarily a medical need, but a very strong social psychological need, is they're looking for correction and they're looking for camouflage. And they don't want to look like they just had a procedure. So this bundle of products that we've created, which are post-procedure related, all have a small correction camouflage element. So it looks like a natural buildable coverage or foundation, and that they're done in a very non-irritating way. So we believe that these three building blocks are critical in any post-service treatment protocol that you may adopt in your practice. And as this is adopted, we see this benefit of, again, the sun care, the skin care, and the camouflage being at the center, really, of the aesthetic practice. So no longer disassociated with the aesthetic services, but rather complementary to all of these aesthetic services that you're already providing. And some of these are IPL, laser resurfacing, microdermabrasion, injectables, chemical peels, and other aesthetic services that you may be offering. Now, before I talk about the clinical trial that we've conducted that supports the use of these products in a post-procedure setting and some of the exciting outcomes we saw, I'd like to give you just a brief commercial on COLORESCIENCE in case you're not familiar with our brand. So we're a brand that's been in existence for over 12 years, and we've always focused on blurring the lines between skincare and beauty or makeup, making sure that we're bringing the beauty today, but ensuring that we're protecting and improving your skin for tomorrow. And we do all of this really with a focus on sun protection is at the core of what we're doing. So it truly is a unique, healthy, beautiful skincare line with the focus of beautifying today, protecting today, and ensuring that you get positive treatment outcomes and skincare benefit for the long term. And when you look at our product portfolio, we have 4 different categories that are labeled here. The first are the treatment categories. This is the building block or the foundation of our post-procedure treatment protocol, and I'll spend a moment on that here in a second. The second is our correction category. This is our mineral corrector palette, and then a very small set of foundations which are easy to apply and to sell in your practice. It's not an overwhelming set of foundations. The third is a series of protection products. So these are our really sun and environmental protection products that we're focusing on in a variety of formats, including this brush that you'll see right here, which is the market-leading brushable reapplication sunscreen that we have in an SPF 30 and an SPF 50. And then the fourth is a set of enhancement products, which includes our hydrating mist, our lip shine products, and a variety of other enhancement products, which can bring out the final stage of our finishing touch protocol. So to focus for a minute on the treatment products, because this really is the cornerstone of what we've established here with our finishing touch protocol. We have 3 main treatment products that are a part of this protocol. The first is our Even Up product, and this is for hyperpigmentation. So any patient that is suffering from melasma or is being treated for hyperpigmentation, brown spots, melasma, this would be the appropriate treatment product to begin and build a protocol around. And this includes our patent-pending proprietary blend called Lumira, which ensures a longer-term skincare benefit focusing on the melasma pathway, melanogenesis pathway. All of these treatment products are 3-in-1. And what we mean by that is they have 3 key benefits that you won't find in the other treatment products in your office. The first is this correction benefit. So they all include some level of camouflage or correction or concealing. For Even Up, that concealing is really done in a kind of a peach tone perspective. For All Calm, it's done in the greens as a way to complement the redness condition that patients have, which All Calm is intended for. And then for Total Eye, again, it's similar to Even Up, but a lighter concealer or foundation. So the first one, again, is that correction or camouflage. The second benefit is all physical sun protection. So for Even Up and All Calm treatment products, they include SPF 50, and again, it's all zinc oxide and titanium dioxide with the very best coating that's available on the market. And then the third category that we have for the treatment products is the long-term skin benefit. And so each of these contain a proprietary blend. For Even Up, it's Lumira, as I referenced earlier, which is for skin brightening and pigmentation concerns. For All Calm, that treatment benefit is called Biosolace, and that is focused on redness. And then for the Total Eye, It's a collection of products and ingredients associated with puffiness, dark spots, fine lines, and wrinkles. And so they all have those three attributes. And again, that really is the cornerstone. We recommend using Even Up for those services that are focused around pigmentation. We recommend All Calm for your aesthetic services focused on reds, and for Total Eye on those aesthetic services focused on areas of the eye, or as an additional benefit for the product that's receiving other treatments. These can be used interchangeably if your treatment objective is not pigmentation or redness based, I would say. So that's the collection of the products. Now I'll turn my attention to the clinical protocol itself with that collection of products in mind. So one of the things that COLORESCIENCE has focused on is adopting a very broad multi-center trial experience rather than just often having a small clinical trial that you'll often see with skincare products with a test site or one of the physicians. We're actually very interested in collecting this broad set of experiences. And we value that because it gives us a robustness to the data where we can incorporate a variety of use cases, geographic areas, and practice approaches. And in this particular patient experience study, we were really looking at both patient and practice outcomes. We called this our Ambassador Clinical Experience Study, and it was designed to assess the effectiveness of this COLORESCIENCE post-treatment protocol to improve both patient and practice outcomes. The protocol was introduced to the patient and was administered by the physician following the in-office procedure, with the intention that patients would continue to use this suite of products for a 4-week period of time, at which case they would then come back and we would assess their condition and their preferences at that point in time as well. We had 5 different studies participate. These were studies at various parts of the country, from both the West and the East Coast as well as the South. We had 34 patients enrolled. They were enrolled, and we asked the sites to enroll patients that they thought would be suitable for this kind of clinical trial experience. So the majority of the patients that were enrolled either were enrolled in conjunction with receiving dermal filler, IPL, laser resurfacing, chemical peels, or other services. We provided these sites with a suite of COLORESCIENCE products that included Even Up clinical pigment corrector that I just reviewed a few moments ago, our Sunforgettable SPF 50 brush, the brush-on reapplication sunscreen, Mineral Corrector palette, again, that's in our correction category, and Lip Shine SPF 35. We asked our sites to make sure that this was a protocol that they could administer in 5 minutes or less, so it'd be easy to administer, and they did not have a challenge with that protocol. This was complementary to all in-office services. So this particular set of products were provided to patients complimentary after their aesthetic service. What we measured was both clinical and patient preference assessments, as well as photography. So in particular, you'll see photography at baseline, photography after the patient received their aesthetic service, and then photography after the patient has received treatment of COLORESCIENCE. And finally, it was optional to take photography again after 4 weeks of clinical use with the set of products. And you'll see examples of each of those times of photography. So the first question that we asked the patients and providers, and we found harmony in the responses from the providers and the patients, but we'll show you here the responses that we received from patients. We asked patients, how uncomfortable did your skin feel immediately after treatment and before COLORESCIENCE was applied? And then we also asked them, upon seeing your picture post-treatment, before COLORESCIENCE was applied, how self-conscious would you be to go out in public? So again, they would have received their aesthetic service, and it was a variety of these services. They include chemical peels, IPL, laser resurfacing, microdermabrasion, and some examples of microneedling, as I mentioned earlier. And we asked patients, the provider, to then ask the patient this question. What we found was that patients are extremely self-conscious to go out in public at the end of these procedures. And what was intriguing is that this response was quite consistent regardless of the procedure they received. So even those that received filler, whether it be Restylane or Juvederm, they also generally reported being self-conscious. And what you can see here from this chart is that 94% of patients said that they were either somewhat, very, or extremely self-conscious. And the majority of those patients, over 60% of patients, said they were very or extremely self-conscious at the end of that procedure. That's on a 5-point scale, that was a 4 or a 5. So it is a very real concern that patients have. And this plays out every day in your office with people canceling appointments. They want to rebook the appointment for another day. They may want to book those appointments at the end of the day so that they can not be interrupted because they're afraid of how they're going to look. They're often not coming back as frequently as they could because they're concerned about how they're going to look at the end of the service. The second question we asked them was, what percent of patients were uncomfortable? And this was somewhat of a surprising result for us and quite consistent. It skewed lower on some of the procedures such as dermal fillers, and much higher on things like IPL, laser resurfacing, microneedling. And that was, what percentage of patients were uncomfortable? We found that about 50% of patients said that at the end of their procedure, they were either somewhat, very, or extremely uncomfortable. And the majority of those patients said they were very or extremely uncomfortable. So 4 or 5 out of a 5-point scale. So that kind of sets the stage of the problem that we're trying to address with the right skincare regimen. Okay, the next step in the protocol was to have the practitioner apply product to the patient. We then had the practitioner have the patient look at themselves in the mirror and respond to a series of questions based on now having this set of products applied to them. And it was the products that I just referenced a moment ago. And what we found is that of the patients that said they were very or extremely self-conscious, so again, that was about 80% of patients, we found that 95% of those patients said that they were extremely, very or extremely less self-conscious. So they're way more confident, way less self-conscious now that they've received our products. And I'll show you some pictures here in a moment that helps demonstrate that point. It's quite obvious for them, though, that the correction and the camouflage benefit of both the treatment product, in this case, Even Up, and the correction benefit of the mineral corrector palette that they received, applied in a very easy to apply way, has really given them a lift in their confidence and reduced their self-consciousness after this procedure. The second finding was also quite illuminating for us and the accounts that worked on this. And I think, again, it's a testament to the ingredients that we use, including zinc, our active ingredient that we use at such high levels in our products. And that is, of the patients that said they were very or extremely uncomfortable earlier, 88% of them said that they were less uncomfortable, very or extremely less uncomfortable after the application of ColoreScience products. So again, 95% are more confident and 88% are more comfortable after the administration of the ColoreScience Finishing Touch protocol. And this is borne out in treatments. So here's an individual that received a Zeo Stimulator Peel, Dermaplane, and Zeo Brightening Mask. And you can see on the left is her baseline picture. So this is before she received her treatment. The picture on the right is what she looked like immediately after treatment. You can certainly see the redness, the puffiness, a bit of edema, and frankly, she also said she had a fair high level of itchiness in this particular case. After ColoreScience has applied, I wanted to look at this picture. You can see how much more even her skin tone looks. You can see that that redness has gone away. You don't notice the swelling as much. And you can see a patient who's clearly ready to go on with her life and looks happy. And this is a patient who's going to walk out of your practice now representing the practice in a much better outcome, in a much better way than she would have earlier. So in particular, this patient said she was bothered by redness on a scale of 5 out of 5, swelling on a scale of 4 out of 5, and itchiness on a scale of 3 out of 5. After the application of COLORESCIENCE, she said she noted a notable decrease in redness and swelling at a scale of 4 and 5 out of 5, and then also provided a reduction in itchiness on a scale of 3 out of 5. 4 weeks later, this patient came back and provided terrific feedback and provided all 5s on all of the questions that we asked that I'll share with you later on. So one example of a very happy patient of the 34 that were a part of this trial. So patients are more comfortable, they're more confident. Now we move into the part of the presentation where we begin to bridge from the patient outcome to practice outcomes. And this is really somewhat of a bridging question for us then, where we ask the patient how the addition of COLORESCIENCE impacted the patient's perception of the procedure that she just had. So not just how she felt now, but what the associative value of the procedure of the COLORESCIENCE regimen has on the procedure that she just received. So beyond their own physical perception, but now it begins to translate to how she feels about the practice, how she feels about the practitioner, and how this patient feels about the procedure that was just performed. In particular, the question we asked them was, how much did the addition of COLORESCIENCE products improve your perception of the procedure you just received? And you can see in this pie chart, 87% of patients said that COLORESCIENCE improved their perception of the procedure on an either very or extremely basis. Only one patient said that it did not improve their perception of the procedure at all, 1 out of 34. And you can see the majority, 58% of patients, said that the addition of the COLORESCIENCE finishing touch had an extreme impact on their positive perception of the procedure she just had. This is another example of a photograph that was obtained in the clinical trial, where you can see the impact of finishing touch immediately after one of the common services, and that is IPL. So again, IPL has grown about 36% year over year. On a national basis, I'm sure you're seeing some level of that, whether it's IPL or BBL, Clear and Brilliant in your practice. And we had a number of similar photographs to this. You can see the immediate coffee grounds image from IPL on the left. So this is immediately after treatment. This is courtesy of Sand Lake Dermatology. And then you can see after the finishing touch, what a much more muted effect and positive outcome, where that person could go back to work, can walk out of the treatment office, and it's not immediately apparent that she even had a treatment performed on her. If you compare that to that slide earlier, I think you'll agree that the results are really quite profound. So patients are more confident, they're more comfortable, they feel better about the treatment they had. This was the most important outcome for us, though, as it relates to the provider outcome or the practice outcome. So we then ask patients, are you more likely to come back? Are you more likely to rebook the procedure given this kind of treatment outcome? In particular, we ask them, does the way your skin looks and feels now, post-COLORESCIENCE, make you more likely to consider having treatment again? And what we found was that 97% of patients said that they are much more likely to have a treatment again as a result of the finishing touch protocol. I think when you look at this pie chart, that blue area, or the 5 out of 5 or extremely rating, is particularly notable. Almost 75%, almost 3/4 of patients said that they are much more, extremely more likely to come back and rebook the patient. This is exactly the kind of outcome that we would like to foster in all of your practices. And I think any really well-formulated post-treatment protocol should have this kind of objective in mind when you are looking to adopt that in your practice. So patients tell us they're more likely to come back. In fact, not a single patient said they were not more likely to come back for another procedure, and only one patient said that they were somewhat, on a scale of 1 out of 5, gave us a 3 out of 5, so somewhat more likely to come back. We believe this is a profound outcome. And here's another picture that demonstrates this, another IPL patient. Also, in the event this patient is walking back through the lobby, I think you can see she's going to be a walking testament now for the kind of patient care that is being delivered in your office there if you have the finishing touch. I love this picture. I think you can see the broad smile, the engagement and sparkle in her eye. She just feels so much better about being able to re-engage out of the physician office now after having this terrific IPL treatment, but having it now with the finishing touch. And this last picture, patient picture you can see here, is just a blown up view of that, so you can see the profound effect and the profound difference of Even Up and the mineral corrector palette, and how that's providing a better patient outcome. So those were the questions that we asked patients at that first visit right after the aesthetic treatment. We also asked patients and their physicians the same set of questions as the patients had, and we had tremendous conformity in those answers. As I mentioned when I described the protocol, we also asked patients to come back after 4 weeks. The reason for this is several-fold. The first is that we at ColoRescience are not just selling post-procedure products. We're providing products that are intended to be used throughout the course of a patient's life. And it was important to us to capture how the patient felt about their experience with this suite of products 4 weeks later as it related to their post-procedure, but also how they felt about the products in general. And we believe that this post-procedure setting is a terrific opportunity to introduce this product suite like ColoRescience that is formulated to meet their needs, and then to engage with that product suite every day in their skincare regimen. So we asked them a series of questions, and I think you can see the level of response here, all of which were in the mid to high 90 percentile range. The first question after 4 weeks was, will you continue using ColoRescience with your daily routine? Over 90% of patients said they would. So it's a gateway to their ongoing skincare, makeup, and sun care regimen. But it was an effective way to have that discussion now in the treatment office. The second question we asked was, do you feel more confident having the procedure again and more likely to return? This is the same question we asked them immediately after procedure, but we felt it was important to ask them again 4 weeks later, now that they've been living with the outcome of their procedure and they've actually experienced what it was like to have that finishing touch. It's no longer an emotional response or a proactive response or a prophetic response that they gave us at this when we asked it the first time. It's now a thoughtful response 4 weeks later. And you can see that over 90% of patients continue to feel that they were more likely to have a procedure again. So we're very pleased with this response. The next several questions really go to the value of the daily skincare beauty regimen that we're providing, and that's patients do feel that their skin looks younger and healthier with the daily use of ColoRescience. They felt that their skin looked rejuvenated, and that they enjoyed applying ColoRescience as part of their daily routine, as well as the fact that it was very easy to follow these post-procedure treatments. So this was important for us to demonstrate. We felt that it was really, again, not just about the post-procedure treatment, but that it was part of their journey to an important long-term skincare beauty regimen after treatment. And here's the last picture that we have to share with you today that shows you that impact at 4 weeks. So if you look at the left, this individual had filler, so she had a dermal filler and Clear and Brilliant. Then if you look in the middle slide, this is the impact of the finishing touch protocol on her immediately after treatment. And then 4 weeks later, now that she's had a chance to work with our products and adapt them to her daily lifestyle and adopt them in her routine after 4 weeks, you can see what she looks like. So it's an even better outcome. She's not any longer covering the side effects associated with the treatment, and she's really made this outcome her own into a really beautiful skincare beauty regimen. So in summary of the clinical results that we've seen in this 5-site, 34-patient clinical experience trial, we saw that 88% of patients are more comfortable, 95% are less self-conscious, and 100% of patients are better protected because of the brush. And as we look at practice outcomes, we saw that 87% of patients had a better perception of the procedure, 97% of patients said they were more likely to rebook, 100% of staff said that it was easier way to introduce these products when it's part of the clinical trial or part of a post-procedure service in the finishing touch. And so it all boils down to this. With this kind of clinical trial experience, we feel confident in helping our partners right now engage in a conversation with their patients about the benefit that the correct skincare regimen can serve after aesthetic services. And we believe that this is really helping to bridge that aesthetic service to the patient checkout at the retail level now, where they can be confident that they're receiving a better outcome after the service, and it's bridging them into a skincare regimen that makes a lot of sense to them. We've provided a number of tools for our accounts that want to adopt this kind of program. And what we found is really accounts are using this in a variety of ways. So many of our accounts are bundling in this finishing touch protocol after services. Some, in fact, just apply the products as part of the finishing touch and then introduce the patients to those products on the way to the checkout counter. Some only want to use a full set of full-size products because they see the value in that. But we also found that a number of practices that are beginning their engagement with ColoreScience have found these corrective kits very helpful that we've introduced. So these are corrective kits that include those treatment products, either Even Up or All Calm. And then they include 2 of the finishing touch products on a sample basis. So our Sunforgettable brush on a sample size and our mist at a sample size. And this is a value pack. So it's actually priced just a little bit higher than the treatment product itself, but it's a way to introduce them to 3 of the 4 or 5 products of part of the finishing touch in a value-centric, easy-to-absorb way for the patients as the practice begins to get comfortable and see the benefit of finishing touch. And the bottom line is we have seen the results of the finishing touch play out in a number of important ways for our practice and for us. So these are examples of 4 of our top partners in a variety of regions, in California, in Texas, in Ohio, and Florida, so across the country. The top accounts here are doing retail sales in the $700,000 to almost $1 million of retail sales of ColoreScience products. And you can see as they've incorporated finishing touch that we're getting growth in 1 year since incorporating this early on in 2017, that these large practices are experiencing growth of their sales of ColoreScience in the 20 to 60+% range once they've taken on finishing touch. But much more importantly, they've had bigger and better patient outcomes. And what we've heard from them, in addition to the rebookings, is that we're beginning to understand a variety of other benefits that these accounts are seeing as part of the finishing touch adoption. One is that we're hearing that cancellations have been decreasing. And that's because patients are no longer concerned about having an aesthetic service and then immediately having to go back to work or having an event that evening because they know they're going to have this correction, this coverage. We also know that patients are filling up the schedule more easily. So they're not afraid now to have this in the middle of the day, knowing that they're going to go back to work and they're going to have that correction, or they'll be exposed to UV now that they know that they're protected with that correction. And then finally, we're also hearing that patients are beginning to migrate to more advanced treatments and trying more treatments after having this kind of positive result. So we're seeing this play out in a variety of ways in clinical practices, not only in the rebookings that we've already demonstrated in this clinical trial, but also in these other subtle more ways. And then we know that it's translating to more product to them, as we show on this chart. So at the end of the day, why would a practice make this change? It's all about outcomes. It's the way that we started this presentation. It's the way that we're focused as an organization. We want to enhance your relationship with your patients and make sure that your patients have a better patient experience with better outcomes, that they're more confident, more comfortable, and better protected, that the patient's perceptions of your procedures are enhanced, that they feel better about the treatment they had, and they're more likely to rebook a procedure, and that this ultimately translates to more effective practice results with better rebookings, fewer cancellations, new patients that are feeling better about trying this because they now know that you have a protocol that will protect them and make them feel better about the procedure they just received, and that it translates to more retail purchases. And we believe that ultimately that is a true win-win with better patient outcomes, better practice outcomes, and ultimately a better all-around experience for practices that adopt the finishing touch protocol. So with that, I think we have a few moments for questions. I'd like to open it up, and thank you for your time.
Thank you so much, Ted. Yes, we do have some questions that have come in, and if you have any questions you haven't sent over yet, please do type them into the question box on the right-hand side of your screen. Our first question is, someone is asking, is All-Calm good for patients with acne?
So All-Calm has been formulated in particular for patients with conditions associated with redness. We do find that a number of practices are using this as part of their acne regimen. It includes some ingredients such as niacinamide, which many people have formulated in their acne products as well. And it does have anti-inflammatory, similarly, niacinamide, and again, that calming effect of zinc. So especially, I think, relevant as part of a acne regimen, indeed. And you also get that coverage that will offset both the redness and give you some general correction.
Wonderful. And now the one thing that wasn't in the home care kits we saw was the palette. And someone's wondering, is that a back bar product, or is that something that you can send home with the patient as well?
Yeah, it's both. So we don't actually have separate back bar products. We provide testers and full-size products to be used back bar, and that mineral corrector palette is one of those products that's part of the finishing touch. But it is definitely all of these products that are part of that finishing touch, in fact, are they're take-home products.
And what is the cost of the full kit as a take-home?
It ultimately depends on what the products are that they're leveraging. So the corrective kit is right around $130 that I mentioned there. That's the one with the full-size Even Up and All-Calm, as well as the other trial products. So it's a real value. It's about $135, and the MSRP on All-Calm and Even Up by themselves is $120. So you're really getting these other two trials for a lot less expensive. If you're using the full suite of finishing touch products on a full-size basis, it adds about $250 to the patient price. And so, as we mentioned, a lot of our top accounts are bundling that in with the more expensive procedures that they have. And then for something like dermal fillers, for instance, they'll often have that as an additional cost. And sometimes they'll give a discount on that suite of products after the dermal filler. But something like an IPL or laser resurfacing, we do find that a lot of our accounts are bundling this into the price of their service as a way to differentiate them.
And that's why I have a question. Is this safe to use immediately after microneedling?
So that's a good question. As a company, we don't take a strong perspective on that. We really leave that up to the physician's experience and the physician's judgment. As you probably know, microneedling is a very diverse set of procedures today. There is not one form of microneedling, and it's even, from a regulatory perspective, it's an evolving landscape. So what we do recommend is that our products are used in a non-ablative fashion. So once those holes have been closed, we certainly believe that our products are safe to use. And if it's being used outside of that use case, we really leave that up to the discretion of the physician that has the experience with the particular kind of microneedling and the way that they are doing that microneedling procedure in their own practice. I will say we did have some people that had used these products after microneedling in the clinical trial, and we've looked for side effects or adverse events associated with finishing touch with all 34 of the patients, and don't have any reported adverse events after use of the finishing touch in conjunction with any of these procedures that they were used with.
Terrific. And that actually covered the questions that have come in. I did want to let people know, if you wanted to review any of the information or share this with any of your staff members, that this webinar will be available at metaestheticsmagazine.com/webinar within the next day to 2 days. So thank you all for joining us, and thank you so much, Ted, for this great presentation.
Thank you very much, Inga. Our pleasure.
Have a good afternoon, everyone.
Bye.